quite frequently we have to do a caudal block. Caudal means tailbone. So block through the tailbone. That is when you have neuroinflammation and pain that spreads from the lumbar spine all the way to the tailbone and causes severe pain and swelling in that area. This patient has had major injuries and has severe pain in the tailbone area. This is the tailbone region here, and this goes up towards the lumbar spine. And what we do is we do it probably the simplest, most practical, and quite effective nerve block by identifying triangle between the coccyx, which is tailbone, and sacrum, which is the shield-looking bone that is there. So after we identify the two protuberances or bone growths on each side of the midline, then we use local anesthetic and anesthetize as much as possible from the tailbone all the way to the lower lumbar spine region. It requires to use a Tuohy needle. Tuohy needle has a blunt ending, and the opening of the needle is to the top, so as we push it in, it doesn't tear up the different structures and nerves. I'm sorry. Then this enters the space in the sacrum, sacral bone, which is this area, which is about this wide and this big. So it's very easy to find the sacrum and it's thread the needle all the way up to the lumbar spine region. Patient's legs and feet that way, and this is the 6-inch needle that went exactly through the sacral bone space, comes up to the first disc between the L5 vertebra and the tailbone, and this is a perfect position to pour the chemical to calm down all the inflammation that has been caused by CRPS or RSD. The rest is very straightforward. We inject 3 cc's of 0.25% Marcaine with each syringe, and this factory floods the tailbone area, sacral area. We repeat this. This is
it's 3.
Repeat these injections up to 6 times. The dopamedrol is quite a small dosage, which it does the job without causing side effects.
6.
For example, like today we use here, this is a needle, we use here the needle and injected the dopamedrol. That's only 12.5 milligram, whereas the internists, the rheumatologists, they prescribe 60 milligram a day for months at a time. I'm not criticizing or making any opinion in regard to the amount of prednisone that they're giving, but we always want to stay on the conservative side.